I see all adults, but I especially like older people. And I guess that's for two reasons. First of all, I'm an older people myself. But secondly, a lot of older people have such wisdom, life wisdom, and I learn from my patients. I guess I spend more time listening than I do talking. That might be a unusual trait in medicine, but I learn a lot. Most patients have worked in some fields that I know nothing about, and they talk about it. I always ask patients what their hobbies are and their interests, and that really changes them from patients into people. I like to say that I don't really treat patients, I treat people, or individually persons. It's because I get to know them as people and not just as a bunch of medical diagnoses. Yeah, in general, I think the fewer medicines people take, the better, and that might sound like a funny thing for an internist to say, but I do make clear exceptions for things like diabetes, hypertension, heart disease. If you take the medicines, you're going to either live longer or live happier. But my first approach is to try some non-medication treatments.
Perfect.
The big thing I do in my practice is patient education. If I saw my doctor and he said, lose weight and exercise, I'm very polite. I kind of smile and walk out, and then I think, go jump in the lake. That doesn't sound like fun, lose weight and exercise. You lose weight and exercise. But if you explain to the patients the reason they ought to do it, then you're on the same page, and it's no longer a fight between the doctor and the patient. You're both working towards the same goal. So I spend a lot of time educating patients about their disease.
Which in today's modern medicine isn't really rewarded or talked about.
No, it's not, but it's rewarding to me to do it.
Yeah. Which is what we try to cultivate here, to allow that time, and hopefully it works out.
That's what's so nice about working here. I can take all the time I want per patient.